Hello, good evening. So tonight's topic is birth control discussion. And this is something that comes up fairly often in clinic. I see a lot of young women every year that are interested in starting some form of birth control or otherwise having a discussion about family planning. And this is a very, very important question that every female with a uterus that works, that is obviously sexually active, should consider the answer to is, do you want to become pregnant in the next year? And the reason that this is a very important question is because if it's not thought about or considered, then a lot of women end up with a surprise baby at some point during the year, a surprise pregnancy. And the question, do you want to become pregnant in the next year, is also very important because without something to stop pregnancy from happening in somebody who is sexually active, basically about 20% of the time they will become pregnant in the next year. As a matter of fact, one of the definitions for starting to work women up and men up, it's a fertile couple, for contraception or fertility issues is whether somebody has not been able to become pregnant in a year's time, and that's about when we actually start to do the investigation to see what's happening with it. So of course, women's health and the topic of how they're able to control their ability to have children is a bit of a hot topic. So I do hope that you guys enjoyed this presentation on the options. So another reason why pregnancy and being able to influence whether or not the body becomes pregnant is very, very important is because about half of all pregnancies that are conceived in the United States as of 2011, now using a little bit of outdated data, were surprise or not wanted. And of those ones, about half of the surprise babies were done while the woman was actually on birth control or some sort of contraceptive plan. And so because 45% of pregnancies every year are surprise or otherwise not wanted, that puts us at the high price of having to figure out, well, what happens to those unwanted surprise babies. We have about 1.1 million abortions in the United States every year. And the children that are born to a woman that was not expecting to get pregnant or did not want to get pregnant are at really high risk for medical issues. Much higher risk for birth defects, low birth weight. And one might think, wow, I want a small baby, easier to have. No, you do not want a small baby. There's a lot of issues that happen with children that are born with really low birth weights or lower than average birth weights, much more medical problems with them. The children that are born in such a situation tend to have poorer physical mental functioning throughout their early childhood. And then for the mamas, there's also some risks to these unintended pregnancies as well. Higher rates of depression, for example, higher risks for physical violence or being in a relationship that causes psychological or physical damage to their well-being. More likely not to engage in prenatal care, so not getting that nutrition, not getting that regular OB care that's needed to adequately take care of the pregnancy and just make sure everything's going okay. Less breastfeeding, so the children that are born generally don't get as much of the breast milk in that situation. And of course there's the financial burden of caring for the children in the situation or the household or having to travel in some cases. There's in a growing number of states where abortion services are not offered or which are being very, very difficult to offer. And so women sometimes have to travel across state lines in order to get access to those services. And so there's so it's basically a very big issue in the United States. So of that 50% or 45% more accurately of unwanted pregnancies, if you look at that big group and you just focus on the teenage population, girls who are age 15 to 19, about 82% of the time when those youngsters get pregnant, it is usually a unintended pregnancy during that time. And so the article I was reviewing on this topic, it kind of went through a bunch of the different reasons why there were so many unintended pregnancies. They interviewed all these women and they said, well, obviously not everyone, but a sample of these women, and the answers were varied. About 33% of the women that had a surprise pregnancy, an unwanted surprise pregnancy, 33% of them thought that they couldn't get pregnant for one reason or another. Some other ones were, it's okay if I get pregnant, it's not that big of a deal. Others said their partner did not want to use any contraceptives. Others were concerned about side effects of medications or other contraceptive methods. And then others thought that they were sterile or thought their partner was sterile. And many also cited lack of access to care. So at the end of the presentation and talk, I'm going to list out some references that you guys can look at that might give you some additional ideas about different options of taking care of yourselves and your family members around the country as well. So again, it's a very big topic. So of course, if the answer to the question, would you like to become pregnant in the next year, is yes, yay, great. I highly recommend beans and greens or prenatal vitamins or a chew of those chewable children's tablets every day to get enough folic acid in general, so that in case of a wanted or unwanted pregnancy, whichever way it goes, that you're prepared, that you've got enough vitamins and minerals and really good healthy stuff in your body to support a healthy pregnancy. And if the answer is, really don't want to get pregnant in the next year, and that's what tonight's talk is all about. What are the various options? How well do they work? And some different ways of thinking about birth control or family planning as another way of putting it in a way that works well for you. Personally, I always encourage my folks who have the children of ages, I don't know, and any time that a woman is got their active periods, they are capable of having children. And that's one of the things that it's really important to talk as a family about those teenage years and kind of preparing the children for whatever the next phase of life is for them. Because everybody's family values and such is going to be a little bit different. And so I always like to personalize the talk. Obviously, tonight's talk is a little bit more general because, I can't control who sees the video or doesn't see the video. And so it's very important because if the youth are looking for sources of good information about birth control, one of the number one places they turn is family members. But then again, another very popular topic or place to turn for help is their peers. And their peers may not be giving them very accurate information, or worse yet, maybe giving them information that is slanted to their favor. And then also, the children these days have very easy access to the internet, and so there is a mix of good and not so good information in that regard as well. Sometimes young girls are told by the boys, hey, if you loved me, you would, and then fill in the blank. And other times, you can't get pregnant if you've never had a period, if you can't get pregnant if blah, 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 blah. And so the quality of information that people are exposed to really varies, and oftentimes young minds can be influenced in different ways that you want to have encourage everybody to have that conversation. So getting on with it a little bit more. So there's different kinds of choices as to ways in which to prevent pregnancy. Everything from the really, really effective but invasive sterilization down to the not quite as effective but might work a little bit natural family planning methods, and everything in between. So most of the time, the folks that are looking for contraception, a lot of them have in mind something they want already, and so I encourage you guys to look at the resources and kind of judge for yourself what might be helpful. Pills are by and large one of the biggest things that people think of, or the most popular that people think of in terms of pregnancy prevention. And so basically there's a couple of different ways of looking at birth control pills, so we'll just start there since it's common. Does somebody want a low dose or a regular dose? The benefit of a low dose of birth control pill is that it's just a small amount of hormones, and so a little bit less likely to have some of the side effects. Side effects of birth control pills, generally speaking, because of all the hormones, have to do with things like sadness or moodiness. Basically, the pills are telling your body to pretend like it's pregnant, and so it mimics the side effects of pregnancy. So especially in the beginning, things like nausea, breast tenderness, bloating and gas, and so forth, can happen with any style of hormonal birth control pill type of contraception. Blood clots are a risk with any kind of birth control. The risk for blood clots is much, much higher in the women who are smoking and the women who are getting, as we say, elderly in age. And in OB terms, I'm going to cry with this one, but in OB terms, women who are over age 35 are termed as elderly. And yes, my friends who are here are laughing and pointing at me, so oh well. You gotta get old sometime. I got gray hairs too, guys. So anyway, so much for all of us elderly folks who are out there. But if you're using tobacco, another reason to stop using tobacco is if you use it while having any form of hormonal birth control, much higher likelihood of getting a blood clot, which could lead to a stroke or a lung problem like a pulmonary embolism. Basically, blood clots to the lungs are not good for you, and highly advise avoiding them. And plus all the other problems with tobacco. Anyway, so low dose versus regular dose. So the benefit of the low dose is a little bit less likely to have those side effects, or those side effects might be a little bit milder than at the regular dose. However, the trade-off with the low dose is if you want to use it for purposes of not having a baby, basically you got to take it every single day at about the same time. And if you skip a dose, just plan to forget it as a reliable method during that course of the month, because regular birth control, if you miss a dose, you can get away with taking 2 like the next day that you remember, a day later. But obviously you can't do that too often either, because then again the birth control doesn't work. And that's why of the 6.1 million surprise pregnancies in the year of 2011, half of those women were using contraception, but the biggest problem was it wasn't consistent, or it wasn't really being used as directed as well. So, and sometimes it is used as directed, but other biological things happen. Like for example, women that have excess weight, the medical definition of obesity is a BMI of 30 or above. As I mentioned in other video presentations, that extra weight, basically the fat tissue doesn't just sit there, it's hormonally active, and so it can make the doses of things like birth control maybe not as work as well as if that extra weight wasn't there. And then also, the other thing is that when women are taking certain other medications, like an antibiotic, you come in for a urinary tract infection, and we give you some Bactrim or some other medication to help you with your infection, and you say, okay, great. You take your medication, you keep taking your birth control like you've always been doing, and the next thing you know, you're missing your period. Wait, what happened? The reason for that is that even in regular full-strength birth control, the use of certain antibiotics basically takes that birth control that is floating around in your bloodstream. It's bound up to this protein, and that's how it works. And it kind of knocks it off of its protein, and the antibiotic, takes its place, so something else is in there. So the short version is that certain medications can make the birth control really not work so good. And if you know about that, then you can use other methods as well, or for pregnancy prevention during those times. So anyway, low-dose birth control is okay, but I call it flaky because you got to be really, really consistent. That's the type of birth control you want to have maybe an alarm set on your clock, or take it during the lunch hour, because sometimes people will be like, oh, well, I take it first thing in the morning, have it attached to their toothbrush or something. And then on the weekend they sleep in, and maybe it's outside the window of really working as well. So a lot of people eat lunch around the same time every day, or just find some time that works well, but try to keep it within the same hour every single day. The regular dose birth control, as I hinted at, does work a little bit better and a little bit more effectively for contraception. The main things with that is, again, all of those side effects that can happen with any of the types of birth control that have hormones in them. Is just that it's a little bit more likely to happen with the full strength. Some of the full-strength birth controls have gotten a really bad rap because of some press releases that were done over the years. So I encourage you to read about the particular kind that you might be interested in, just kind of see what you think on it. Some of those we choose based on their other various side effect profiles. Some of them have a little bit more testosterone-like activity, others have a little bit more of other hormonal activities. Yaz, for example, is one that is popular among the dermatologists for helping to fight the acne and such. So there's a lot of options out there. Birth control has been out since, 1960s, and so the manufacturers have had a lot of time to manufacture lots of variations of various forms of birth control. And so that's why it's a lot of different options available. Do you want it with iron? Do you want it without iron? I mean, go take your choice, as it were. So the first thing with the pills is low dose versus regular dose. And once you kind of sorted that out, so I'll put the low dose aside for the moment and just focus on the regular strength. So the second question with the regular strength birth control is, do you want a period every month, or do you want a period every 3 months? And a lot of women enjoy the freedom of having a period about every 3 months, especially the women with things that are hormonally driven, such as sometimes migraines can be related to the periods. Sometimes women get endometriosis or really, really awful crampy periods. And so they either take their birth control continuously for 3 months, or they take a form of birth control that's kind of designed to last for 3 months at a time. So, for example, Yolessa is a popular kind. I think the other brand name of that is Seasonal or Seasonique. There's a lot of different brand names of these, so that's just a quick reference for you. And then some women say, all right, that's great, good information, but I really don't want to have to remember to take a pill every day. And that is good on you for being aware that you're the type of woman that does not want to have to eat a pill every day, because if that's a barrier for you for successfully using it, you want to be aware that of how to either combat it or just choose a different method, because there's a lot of choices out there as far as what to do. So the next category I'm going to call devices. So the first, well, it's not as much of a device as some of the others, but the first of that is the birth control patch. And so the birth control patch, basically, as it sounds, is kind of like Band-Aid with hormones soaked in it. That's a kind of a crude method of describing it, but it's essentially that. And so basically the woman would take a spot on the belly, put the patch on, and leave it on there for the month, and then take it off, have the period, and then get a fresh one and put it on. Obviously important to take it off so you're not like overdosing your body with hormones. And the benefit of that is for the women that don't want to have to remember to take a pill every single day. Some of the downsides of the patch are skin sensitivity. Some of us are sensitive to glues and adhesives and plasticky little things, and so if a woman is sensitive to that, it might not be as good of an idea. Some of the earlier concerns of the patch were that maybe the hormone levels would vary. You might be going out and running around and getting sweaty in the summertime, and there's a lot of different things to think about with the patch as well. So I encourage you, if that's something you're interested in, to read more about it and to weigh those risks and benefits for yourself. Another one that's a device is a NuvaRing. So slightly more invasive, but really not that much. Basically, the NuvaRing is, instead of a patch that's soaked in hormones, it's a little flexible ring that is soaked in hormones, and basically very easy for the women that know how to use tampons. Basically gets put up inside. It sits there for about 3 weeks. You go ahead and take it out and basically have your period. Get a fresh one from the refrigerator, mind you. These are ones that have to be refrigerated, and then repeat. So basically the benefit of the NuvaRing is, again, you don't have to sit there and remember to take a pill every single day. The downsides of the NuvaRing, some women find it changes their vaginal flora a little bit. Basically, they might get more bacterial vaginitis or more yeast infections. That's very person dependent. Some people just love it and they find that it's very convenient for them as well. So again, read up on it if you're interested. Nexplanon and the IUDs. So we're kind of going up in terms of how long-term and how invasive we're getting. So the birth control forms that we've discussed so far are basically things that are useful for women that are looking to maybe have a child in the next year or two, or that are wanting something they can reverse very quickly. You know, I want to start it when I want to start it, I want to end it, and then be able to have a baby right away. The next ones are a little bit more invasive. So the Nexplanon, and I'm sure they'll have a new version of this in the upcoming years, so stay tuned to the resources on that. It's changed names a couple times already. Basically, this is a small plastic implantable device, and it goes in the upper arm, and basically there's a kind of like a needle-like thing that you numb up the area, you make a little cut, and kind of slip it up in the tissue, and then the way that the woman knows it's there is they can kind of roll their fingers over it and they can feel that it is present. Obviously a lot more invasive than the other forms of birth control, but the plus side is it tends to be more effective because it takes the user out of the question. So it's not like you're forgetting to take the pill or leaving the condoms on the nightstand or something along those lines. It's like it should be working immediately, and it is a very helpful form of birth control for many women. The downsides obviously are getting a implant, as it were, and sometimes people can get scarring, sometimes there can be bleeding, there can be infection. All of those are fairly rare. Bruising is probably the most common side effect that I've heard with that one. I did the training for that one, but I tend to not use it because for my patients, the only reason is because there's always been other folks in my clinic that were doing it all the time, and for me, I wanted the patients that were getting it, instead of me figuring it out once every other year or something like that. Be like, yeah, my partner right down the hall, they do it literally every week, all the time. Go have done with them. So anyway, so the clinic does offer that as well. Very, very effective and convenient. The downside of something like an implantable, though, is if you have any trouble with the hormones, it's a little bit more tricky to stop the influence. So basically, the way it works is it's soaked in the hormones, and so in the very beginning, you're getting this really high dose of hormones that kind of gradually kind of tapers off over 3 years. So if you're not in the baby making market for at least 3 years, it's a great choice. But in the beginning, when the hormone levels are high, you can get more mood swings, sometimes more depression can happen. And also the period stuff can be a little bit all over the place, because when the hormones are high, they say that the number of days that the woman bleeds per month is about the same per the manufacturers, what they were telling us at the trainings, but it's scattered. So you might have a little here, and another here, and another period here, and so it's like pretty much all over the calendar as far as having breakthrough bleeding during that time. And so that's something to be aware of before going there. So again, encourage you to read more about that as well. The next level of invasiveness, but also very, very effective, is the intrauterine device, or IUD. And the reason that those are lovely is because we have 3 varieties now, depending on whether you want the contraception for 3 years, 5 years, or 10 years. And it also has a choice of either having hormones or not having hormones. So if you want the no hormones, give it to me for 10 years option, the copper IUD is a gold star with that. I gotta admit, it is a little bit painful on the application of any of the IUDs, especially if a woman has not had any children in the past, because if a woman has had a child already, the opening of the womb, the cervix, is already been stretched, it's already changed its shape, it's already a little bit more open than the womb or the cervix of a woman who's never gotten pregnant or given birth. And so basically it's not a contraindication, but it is a little bit more sore to put in if that's the case. So anyway, it's you get the place put in there once, and then basically it's good to go for 10 years. Side effects of that include a little bit more crampy periods, especially in the beginning while the body's still getting used to it. But then after that, the body kind of adapts to it and it just kind of sits there. And the origin of the IUD, they like to tell us in med school, it was actually the folks that were crossing the desert with their camels. One of the tricks, if you're crossing the desert, you don't want to get your camel pregnant during that journey, because they got to be able to carry your water and all that stuff for the whole journey. And so legend has it that they would put a little tiny piece of sand up inside the camel. Leave that to your imagination for that, poor camels. But anyway, the idea is that something that was a little bit irritating to the uterus was just somehow able to prevent the pregnancy. And the same thing happens with the copper. Basically, it makes it so that the lining of the uterus just doesn't accept any fertile eggs as well. And so I do not recommend sand for our ladies, but basically the copper IUD is that principle made into a device. The next version of that is a Mirena. So basically it's a 5-year lasting IUD, and it's again soaked in hormones. And what the benefits are for this one is, again, extremely good percentage of effectiveness for the birth control. Again, same with the copper device that goes on the inside, a little sore when it's put in, but then you don't have to think about it for 5 years. One of the downsides of the Mirena is it can sometimes take the body just a little bit of time to wake up after it's been used. In other words, sometimes the hormones are so good at quieting down the periods, which is a benefit, by the way. A lot of women don't have as strong of a period when they're on the Mirena, and others, their period stops sometimes all together for a number of years on there. And so a lot of women like that as a benefit. But one of the downsides is if you want to take it out and have a child immediately, some women it might take the ovaries just a little bit of time to kind of wake up and remember how to do their job and make eggs and to be ready to have a child afterwards. And so the Mirena is an excellent choice for especially those that have really crampy, awful, painful periods, especially women with like endometriosis. A lot of them like the Mirena as well, and that want to be able to have a form of birth control that they don't have to think about, and it's there for a while. The Skyla is relatively new. It's very similar to Mirena. The only difference is that the Mirena is good for 5 years, the Skyla is only good for 3 years. You know, pick your choice and use something that, again, the question is, do you want to get pregnant in the next year? And if not in the next year, well, when in the future is that something you're thinking about? Sometimes women know and they have their whole life planned out. And sometimes it's a little, got to figure it out when it comes, right? So anyway, the devices, so that's the majority of the devices that are out there. And so the next version of things is the shots. So when we're talking about forms of birth control that kind of can stop your period or that can basically make it so that you're maybe not having a child right away after you stop the birth control. The Depot shot is really good choice as well. This is very popular for some of the younger women who don't want to think about pills, really don't want to have anything implanted, and kind of get squeamish when we talk about some of the other devices as well. And so for them, it's a lot easier to just show up at a clinic, get a shot in the arm, go away, and just come back in that window of time where it's useful to have that. So the way in which the Depot works is basically it's, again, kind of a high dose of hormones, and so you get the same kind of side effects and problems as when you get the implantable device, only it's just a shot in the arm rather than a plastic thing in the arm. And so sometimes the moodiness, the acne, the other side effects that go along with the pregnancy hormones can be a little bit more intense with the Depot shot, which is one of the reasons why in somebody that's brand new to birth control, I usually will recommend trying, if they want something short-term, to try a pill or something first so they kind of get a sense for what the side effects are going to be. Because if you don't like the side effects of a pill, you just stop the pill and you do something else. If you don't like the side effects of a Depot shot, sorry, you got to wait 3 months for it to kind of wear out of the system. And so, again, knowing yourself and knowing what kinds of things you would like is very, very helpful. The other thing with the Depot shot is it is an excellent form of birth control if it's done within the window of time. So sometimes women will use the Depot shot and then kind of forget or don't have access to health care, or some other reason they miss the week or two that they have to get back in to get that repeat shot to keep them from getting pregnant in the next 3-month cycle. And so I always recommend that if someone's out of their window, so to say, just double check the pregnancy test, make sure you're not pregnant before you get the next shot going as well. The other thing with the shot is any of the forms of birth control, a lot of women associate with weight gain because of the hormones, maybe a little more emotional eating, maybe some other process going on. The women's health counselors that I've worked with, by and large, say not to worry about that aspect of things because even without birth control, they might have gained the weight anyway. And also, if you have a awesome, healthy, whole food, plant-based diet, my verbiage, of course, or an otherwise healthy diet and exercise regimen, usually the concerns about weight control are not as often. But I usually, when I hear people complaining about birth control, oftentimes people tend to mention to me personally that they feel like maybe the shot contributed more than the other forms. But whether that's just hearsay or not, there's something there. So, alrighty, so moving along. So we talked about the shots, we talked about pills, we talked about devices. The real big one's sterilization. Now, if you really do not want a child, sterilization might be the way for you. For the women, it's pretty invasive. It's an abdominal surgery to go in there and to tie the tubes. 99.9% effective. Very, very, very rarely a tube that's been cut sometimes can find the other half of it and reconnect, but that's extremely rare. Probably more likely to win the lottery in those cases. And then the other form of sterilization, which the guys can take care of, is the vasectomy. So in our clinic we have a person who does vasectomies. Oftentimes urologists do them. Sometimes family practice doctors do vasectomies as well. And I gotta say that it is a very easy procedure to do. Can be done right there in the clinic. And basically, I can't say it's pain-free, but it is a lot easier on the total family, generally speaking, than the tubal ligation, which is the female sterilization. So for the vasectomy considerations, I always recommend that people consider it to be a permanent procedure, because yes, there are people out there that work to reverse a vasectomy. However, it is very expensive and there's no guarantee that it's going to work. And so the other thing with the vasectomy is, before you use it as a form of birth control, just do your follow-up appointments with your physician and make sure that all of the sperm has been cleared out of the system, and that it works in that sense. Because if the sperm is so prevalent in all the tubes and all the areas of that area of the anatomy, that if there's even a little tiny bit left, and you think, okay, it's been a certain number of times since I've had the vasectomy, it's been a certain number of weeks, I should be good to go, right? And then you rely on a form of birth control, and if there's even one sperm floating around in there that just happens to go up in the area, then surprise! So again, that's one of the reasons why sometimes the people thought they were sterile and didn't quite work so well. So make sure that the vasectomy is double checked to make sure it's actually working as desired. Alrighty, let's see, covered almost everything. The natural family planning, one of my coworkers back in residency was our expert on natural family planning, because many people like to work with the body cycles, and so there's a lot of good information out there as a reliable form of birth control. It's not necessarily as reliable as the others, but in some cases it's the only thing available, is basically being very, very aware of the cycles and knowing exactly when that ovulation is, when are your eggs ready, and so forth. I was able to visit India once, and there's a big access barrier. Like, not everybody is able to get access to birth control, especially in some of the poor rural mountain areas. And the local hospital I visited had this beautiful program of giving out these little bracelets to the women. And it had like 4 red beads, if I remember right, 4 or 5 red beads that they would start counting on the first day of the period. And so basically they could have sex during certain days of the month, and then they just kept counting every day after that for the full about 28-day cycle. And for that, for those women, it was very liberating, because they were much better able to plan and say, not tonight, honey, I'm on this bead. Basically, it was a very good way of being able to give the women that were trained in that way a little bit more control over their pregnancy cycle. For other folks, there's a lot of different techniques. There was a way of measuring the thickness of the cervical mucus, I cannot tell you much about that because I'm not an expert in that area, and how well it works or doesn't work as far as that goes. And some women would take their temperatures every night, and then there would be a change in the temperature, and like, okay, fertile time. And so the natural family planning is really best for women that want to get pregnant, but maybe not right this very second. But if it happens, it's really not that big of a deal because they kind of want to get pregnant anyway. Is how I look at that one. It can be a very useful form of birth control for those that want that. And one of the things you might have noticed is throughout this entire discussion of various ways in which birth control can be taken or used, really none of these methods that I've described so far protect at all against sexually transmitted diseases. And that is very, very important because for the teenage population, they say that about 1 in 5 teenagers has a sexually transmitted disease. Of those, chlamydia and gonorrhea are 2 of the most prevalent. The chlamydia is particularly troublesome because it often has absolutely no symptoms whatsoever, so the boy or the girl often has no idea that it's there. And B, if it is there and not treated, it can get up into the little tubes, the little fallopian tubes, and instead of those tubes being, open and able to carry the egg, from the ovary to the womb, basically it scars them down, and it can really sometimes permanently change a girl's ability to have children in the future. And it's a very, very easy to treat, easy to screen for condition. And so the U.S. Preventive Task Force recommends that all women that are in birth control from ages, I guess it doesn't really have so much of a lower age. I usually pick around 14, 15, somewhere in that time frame. Not because I think that everybody's doing stuff, but, we just don't know. So basically, the idea is you just pick the earlier age, or if somebody is sexually active, you pick the time of debut on that. And every single year up through age 24, the U.S. Preventive Task Force recommends a screen for chlamydia, gonorrhea annually. And that is easy. You just pee in a cup. Results come back like a week later, and obviously if positive, then treat it. Another reason why that screening is very important is not only because if it's missed, it can impact a woman's ability to have children, but also there's a couple of trends that have been starting to come out. Sometimes a couple will be using condoms, and apparently there's a new thing where the guy somehow loses the condom or takes it off in the middle of things, and then surprise, surprise, people at risk for pregnancy, they're at risk for sexually transmitted diseases, and obviously a violation of trust in an intimate relationship or encounter. Another reason to limit the number of partners and get to know each other before you get to know each other, if you know what I mean. But basically, the rates of sexually transmitted diseases are climbing, especially in the younger populations. One of the papers I was reading recently talked about the use of Tinder and the rates of things like syphilis and HIV creeping up in our younger generation especially. So again, please be careful in your relations with other human beings. It's a beautiful world, but there are some risks to be had. We'll probably do a whole talk on sexually transmitted diseases at some point, but some of them are easy to treat, like the chlamydia, just take some medicine. The gonorrhea, just get a shot or take some medicine. They go away right away. Things like trichomonas is a vaginal gel that gets treated. Syphilis, a shot of penicillin. Trouble with syphilis is it can cause lots of other problems. And then the ones that last for forever, HIV, yeah, there's a lot of medications that can be used for it, but there's a lot of resistant strains of HIV out there. So again, please take care of yourselves. And then hepatitis is sometimes treatable depending on the variety, and that's again often no symptoms. So if somebody is engaging in sexual relations and is not absolutely confident of themselves or the partner, or even if you are confident, you might want to consider getting screening for these things, because the consequence of missing something in some cases actually could be death. I mean, HIV is lethal sometimes if it's not caught and treated. Syphilis and hepatitis, the hepatitis can sometimes lead to liver cancer later in life if it's not taken care of. So again, being aware and knowledgeable at all stages of the game just can save your life someday. Not to mention cervical cancer rests on a virus that can be transmitted sexually as well. So getting into the last category of contraceptive choices is the things like the diaphragms, cervical caps, which are very similar, the sponges, the boy and girl, male and female condoms, simply using spermicides, abstinence, which is just not having sex once in a while, and the withdrawal method. The trouble with those styles of birth control is I've seen some cases where, for example, a young couple used condoms extremely effectively, very well for like 5 years. Then they came in and said, "All right, doc, we're ready to have a baby." They went ahead and got pregnant, and then right back on the condoms. And they did this, and I got to deliver more than one of their babies, so it was fun. But that's not always the case. You know, a hole can happen, can get left on the shelf at the wrong time, not consistently used. It can be in a wallet or something and get too hot because something was left in the car at the wrong time. Basically, there's a lot of problems that can happen or just not being used effectively in there. So although they are useful, they basically are not as reliable as some of the other forms of birth control that are out there. So there are these wonderful tables that will basically kind of compare birth control with birth control, list the side effects, list how effective they are, and so forth. So the most important part of all this is the conversation that you have with your own personal family physician or your own personal gynecologist, or even the health department. A lot of the health departments will help women with basically family planning, kinds of things, especially in areas where they have funding for this. And what is the cost of not being proactive and not planning? The cost is essentially 6.1 million pregnancies that are surprise. And so learn about your body, learn about the different kinds of ways in which these things are easy to regulate, and hopefully between you and your personal physician or other caregiver, you can choose something that will match yourself and your lifestyle. The best kind of birth control is the one that you want to do and the one that you will remember to do and feel drawn to do. Anyway, I hope this little discussion on birth control was helpful. I guess there's one more that I forgot to mention, and that's some of the emergency contraceptions. Those are sometimes available over the counter as Plan B. I would encourage you to learn about that as well. But that's one of the ones I don't recommend leaning on as often, just because when you get a load of the hormones in the body all at once, it kind of can shift things up. But, there's various options on those. So anyway, stay tuned. Please look at the references and resources link below. And again, please enjoy and take care of yourselves, and have a great day. Thank you for watching. Bye-bye.